Hello everyone, welcome to Pediatrics by Dr. Anand. Is my voice audible to everyone? Please put a message in the comment section. Thank you. Yes or no? Hello everyone. Hello. देखो मेरा पेन काम कर रहा है. Okay, one second. I need to check whether my pen is working or not. Good evening everyone. Welcome to Pediatrics by Dr. Anand. And I hope my voice is audible to everyone. Please put a message in the comment section. Thank you. आवाज़ आ रही है या नहीं आ रही है? Okay, I think आनी चाहिए. आ गई आ गई आ गई। ओसामा का फ़ोन आया था अभी। ओसामा आपने कॉल किया था अभी। ओसामा का इसलिए फ़ोन आया होगा। क्लास है आपकी, आ जाओ। यस एग्जैक्टली। इज माई वॉइस कमिंग टू एवरी वन, येस और नो? वन सेकेंड वन सेकेंड। गुड इवनिंग। थैंक यू डॉक्टर ओसामा। डॉक्टर ओसामा का मैस कॉल आया अभी, आपकी क्लास है, किधर किधर, जल्दी जल्दी आओ जल्दी आओ। यस ब्रो, यस ब्रो। या हेलो एवरीवन, वेलकम टू पीडियाट्रिक्स बाय डॉक्टर आनंद। दिस इज द ब्यूटीफुल अन अकेडमी नीट पीजी प्लेटफॉर्म। सॉरी आई गॉट लिटिल लेट, मेरा वो सॉफ्टवेयर में कुछ इशू चल रहा है। एंड यस, गुड इवनिंग एवरीवन, लेट्स टॉक अबाउट इट। टुडे इज द लास्ट क्लास, दिस इज द लास्ट क्लास ऑफ दिस वीक. Saturday, Sunday, Monday, 3 days. We don't not having any classes, and let's talk about it. My name is Dr. Anand. Unacademy helps us to breathe together, connect together, and be together. I hope you guys have taken this 3 month extension on your 6 months plus subscription, and also a 6 month extension on your plus subscription of 1 year and above. Yes, this is a very beautiful platform, and recently this pack was there. I hope you guys have taken it. Also in the Unacademy, our target now is NEET PG 2023, where we have a 6 months and a 3 months subject wise and a high yield module batch. Hello Dr. Ashish Singh, Shubhangi, Himani. Sorry I got little late because gym से भी आना था, आज मेरी थाईज एक्सरसाइज थी. Don't ask, it was very tough. Also at the Unacademy, we have this beautiful NEET PG 2023 test happening and discussion batch for the repeater students. The month is June, and very importantly, the months total are for 9 months. In the Unacademy, as we all know, we have something known as plus subscription, something known as iconic subscription, light subscription, MABS Prof 1 subscription, and then we have the UPSC CMS subscription. It will be helpful for everyone. Yes, good evening everyone. Good evening, beautiful people around. Let's talk about it. Now let me zoom the what you called enlarge the whole class, and I was charging my laptop actually. And yes, let's talk about it, talk about it, talk about it. Let me check whether my pen is working or not. One second, one second. जब निगाहें निगाहों से मिलने लगी. Yes, it's working well. Let's talk about it. Yes, today's topic of choice is our very beautiful tracheoesophageal fistula. Very important. Yes, in this class, we're going to talk about TEF. And most importantly, yes, before starting any amazing segment, we always have a motivating quote. And today's motivating quote we have in Hindi today. So very beautiful. Please read this one. दिल का साफ होना जरूरी है. दिल का साफ होना ज़रूरी है, क्योंकि कोई वादे करके भी साथ नहीं देता, तो कोई बिना वादों के भी ज़िंदगी भर साथ निभा जाता है. सो दिल का साफ होना ज़रूरी है, क्योंकि कोई वादे करके भी साथ नहीं देता, तो कोई बिना वादे के भी ज़िंदगी भर साथ निभा जाता है. जैसे कि डॉक्टर ओसामा, जैसे कि हमारे स्टूडेंट्स शुभम, शुभांगी एंड अमेजिंग ब्यूटीफुल पीपल, हमारे पुराने बैच के इशिता श्रीवास्तव, आवर लॉस्ट amazing people we have. Let's talk about it. Yes, exactly. So yeah, which is the most common congenital anomaly of the esophagus? Today is a very beautiful class with some crazy amazing motivating quotes in between. The class will be spoken in English and Hindi language, and let's just talk about it. Okay, amazing. Okay, perfect. Okay, yes, very good, very good, very good. एक मैं नज़दीक ले आऊँ अपने लैपटॉप को, क्योंकि सॉफ्टवेयर चेंज हुए हैं, मेरे पर्दे चेंज हुए हैं, काफ़ी कुछ चीज़ें चेंज हुई हैं एक्चुअली. हाँ, the most common congenital anomaly of the esophagus is nothing but, of course, is our esophageal atresia. Esophageal atresia is a very beautiful answer. अब समझ के पढ़ें please. Try to link and study. Okay, yes, exactly. Yes, so the most common congenital anomaly of the esophagus is nothing but esophageal atresia. Atresia. What is atresia? What is stenosis? Atresia is nothing but abnormal narrowing. Atresia is nothing but abnormal narrowing is what nothing but atresia. And among this esophageal atresia, the most common problem which the baby, out of that more than 95% of cases will have which problem? The answer will be tracheoesophageal fistula. Among those 95% cases of esophageal atresia, TEF is something which is very important. Tracheoesophageal fistula. Yes, that's very well put. So question number one, this topic will be subdivided into classification, features, diagnosis, treatment, and complications. Today's topic of choice is tracheoesophageal fistula. Point number one, yes, perfect answer. Perfect question actually. Hanji, what is the name of the classification? Dr. Shubham, Dr. Osama, Hanji, what is the name of the classification for TEF? Who will tell me? Yes, very beautiful, very good answer. The name of the classification for tracheoesophageal fistula is, we have Gross classification. जो नाम होता है TEF में classification का, that is Gross classification, Gross classification. And everyone knows, right? And let me ask you 5 more questions. Where do you use West Haven classification? Yes, and where do you use, I would say, Silverman Anderson score? Silverman Anderson score. See, the more you revise, no, million times, the more you will be perfect. West Haven classification is used for acute liver failure. Silverman Anderson score is used in a preterm baby for assessment of severity of distress. एक बच्चे को कितना distress है, हम इस scoring system के द्वारा निकाल सकते हैं. The name is Silverman Anderson score, that is for preterms. और term baby के लिए कौन सा score use होता है? Downey's score, Downey's score. Remember, okay? Perfect. So Gross classification is for TEF. West Haven is for what you called liver failure, acute liver failure, or nothing but acute hepatic encephalopathy. Silverman Anderson score is for assessment of severity of distress in a preterm, and Downey's score is for assessment of severity of distress in a term baby. Coming to the further question, yes, a very good slide, a very smart slide. Okay, where is the problem? Where, see, think, okay, logical, just relax, chill. My classes, just chill, just chill, chill, just chill. So, like, just think, okay, open your brains, okay. Tracheoesophageal fistula. So, tracheoesophageal fistula. Tracheoesophageal. My windpipe and my food pipe, there is a fistula. What is a fistula? Like this abnormal connection, right? Abnormal connection is nothing but fistula. Now it is of various types. Can you, this, as we can appreciate, this is my trachea, this is my trachea, this all is my trachea, okay, and this is my esophagus, my food pipe, and there is a fistula. Question number one, how many types of TEF do we know? So we have 5 types of TEF, type A, B, C, D, E. Okay, straight away question, very simple question. Which is the most commonest type? Which is the most commonest type of tracheoesophageal fistula? Are you understanding? Trachea and esophagus has a fistula, has an abnormal narrowing, which is abnormal, which is a bad thing. The baby will have distress, the baby might not even survive also in some cases. So among the we have the mnemonic, the beautiful mnemonic is nothing but CAD, CAD. The most commonest type of tracheoesophageal fistula is which one? It is type C, is the most common, followed by very importantly type A, and very importantly type D, CAD. The most common is type C, second most common is type A, and the least common is nothing but type D. Okay, type D. ठीक है, that you should know. Okay, perfect. I hope you got it. Okay, हाँ जी, आ जाओ, धीरे धीरे आओ, धीरे समझो. Okay, okay. Now listen very carefully. Okay, I have a question. See, think now, you tell, I'll ask question. It's so nice, no? We do question answer session. I ask you one question, you tell the answer. I ask you one question, you tell the answer, and we end up finishing the whole topic, and then we live happily ever after. है ना? हाँ जी, I have a question, bro. My question is, in a case of type A, tracheoesophageal fistula, we can appreciate, what can you make out by this picture? Can you see that this is my esophagus? It has a proximal end and it has a distal end, and it's like a blind end, and the trachea is separate. समझ में आ रहा है कि इसमें connection तो नजर नहीं आ रहा. I'm not able to see the connection between the trachea and the esophagus, but one thing I can make sure very well is trachea is like kind of normally placed, but esophagus, my food pipe has a proximal blind and a distal blind end. दोनों जुड़े नहीं हैं इस बातों में, ठीक है? Yeah, there is no communication. That's very good point. Okay, in that one I want to know. So this one, dear, are you understanding, dear? This one. So my question over here is, will the patient will have gasless abdomen, or the patient will have abdomen with gas? This is what I am confused, and can anyone please tell me, bro? What do you think, my dear? पेशेंट को गैसलेस एब्डोमेन होगा या गैस होगी एब्डोमेन में? सी अगेन थिंक लॉजिक, ओके, दिस इज सच अ सिंपल एंड ब्यूटीफुल टॉपिक. What is the meaning of this gasless abdomen and gas wala abdomen? Can I say whenever there'll be a connection between my windpipe and my stomach, then only gas will go, no? Wind, right? Air, windpipe. The air will go from the trachea to the stomach, right? Like if I'm saying abdomen with gas, okay, then naturally there should be some connection, right, between the windpipe and the and my stomach. Then only I'll say no, there is a connection and the air is going in the stomach and gas wala abdomen or gas less abdomen. Yes, so exactly, yeah, okay, Dr. Thor says gas will be there. So my dear, in the type A you will see no gas in the abdomen because there is no connection, my dear. There is no connection between the trachea and there is no connection with my stomach. Are you understanding? This is what I'm trying to make a point over here. In the case of type A tracheoesophageal fistula, like can I write this line esophageal atresia without TEF? Can I say that type A TEF is also known as esophageal atresia? वो तो नजर ही आ रहा है esophageal atresia. And without tracheoesophageal fistula, if I talk about a proper line, are you understanding, my dear? Yeah, exactly. So as there is no connection between the windpipe and the stomach, then I would say, Baba, this looks like a gas-less abdomen. That's it. That's the first point. That's the first point. Okay, yes. Dr. Osama is asking Shubham, hello Shubham bro, how are you? फिर शुभम बताएगा बढ़िया भाई, तू कैसा है? फिर शुभांगी कहेगी मेरे से तो पूछा नहीं, how am I? बातें चल रही हैं बातें. ठीक है, this part is over, bro. Next one. So can we therefore assume in this slide that number one, type A TEF, there is gasless abdomen, and it is the second most commonest type of TEF. Two MCQs are over. Next one, please. Yeah. In the type B tracheoesophageal fistula, type B, this one, bro, this one. Can we appreciate this beautiful picture type of type B? Again, कोई मुझे बता सकता है कि इसमें गैस लेस एब्डोमेन होगा या फिर गैस in the abdomen will be present? Dr. Shubham, Hanji, Dr. Osama, Shubhangi, Ashu, Asha, Swaraj Suman, Mariam Mumtaz, and Osama Sheikh from New York. Anji, so the beautiful answer for this question will be, bro, there will be gas less abdomen. There will not be any gas in this case. Also, this is the exam question. तभी मैं बार बार stress दे रहा हूँ, ठीक है? याद रखिएगा. Next point, please. Yeah, exactly. Which is the most commonest type of tracheoesophageal fistula? The beautiful answer on this planet is number one, it is type C. And as we can see, very beautiful. Now please tell me, will you see a gas less abdomen or will you see gas in abdomen? And I would say yes, I will see gas in abdomen because there's a beautiful connection, bro. Like abnormal connection, not beautiful connection, abnormal connection. So that's what FMG question number one, which is the most commonest type of TEF. The answer is type C. NEET PG question number two. In type C, tracheoesophageal fistula, will you see gasless abdomen or gas wala abdomen? The answer will be gas in the abdomen. And very, very important, very important. One more question which I recently read in the PG exam. The question was, how do you how do you pronounce kind of a tracheoesophageal fistula? How do you say it? So can I write proximal esophageal atresia with distal TEF? Yes or no? Can I write proximal, okay, it's important, okay, proximal esophageal atresia, proximal eso, ये शब्द बहुत इंपॉर्टेंट है डियर, ये एग्जाम में आया था. दैट व्हाट इज द मीनिंग ऑफ दिस टाइप सी? आप देख पा रहे हैं या सी बनता है? कैन यू सी दिस इज सी वी आर टॉकिंग, ओके, टाइप सी. टाइप, कैन वी सी दिस ब्यूटीफुल सी? यस और नो? सी फॉर क्यूट. क्यूट, एक और गंदे वाला सी भी होता है, वो हम डिस्कस नहीं करेंगे. हाँ जी. सो can I write proximal esophageal atresia with distal TEF? Please put a like button. Are you able to understand this word where I'm showing the arrow? I'm telling it's a proximal esophageal atresia with distal TEF. है ना? समझ में आ गया? समझ में आया है? yes or no? yes और yes yes. पहले तभी आगे बढ़ेंगे भैया, पहले इतना बताओ समझ में आया या नहीं आया, क्योंकि you have actually covered 10 MCQs already. In the next in this 20 minutes you have covered 10 MCQs. आज मम्मी को मैंने बोलना भूल गया कि भाई क्लास दे दो. या इट जस्ट Okay, perfect. Dr. Suman, very good. Shilpi, Priya, Thor, Himani, Mariam. ठीक है. झूमेगा आसमां, गाएगी ये जमी, मैंने सोचा न था. Next question, please. Type D. So I am wondering how many types of TEF are we discussing over here? Five types. Five types. Type A, Type B, Type C, Type D. ठीक है. C बोले तो ये C रहा dear. This is C. I can appreciate a beautiful C. Okay, perfect. Type D also. Type D. Can you see kind of a H type or just I type D TEF? I can appreciate this one. Again, can I write can I say there is a proximal TEF also and there is a distal TEF also. दोनों तरफ छेद है ना, यहाँ भी फिस्टुला है, यहाँ भी फिस्टुला है. So proximal and distal TEF I can appreciate in type D. Again, very important. Is this the most common? Is this the least common? The answer is it is the least common. Will you see gas in the abdomen? The answer is yes. Yes. Can we appreciate now? I have covered a lot of MCQs. Can we appreciate this point? Which one has gas abdomen? अभी तक तो समझ में आता है टाइप सी एंड टाइप डी. विच वन इज गैस लेस एब्डोमेन? गैस लेस टाइप ए एंड टाइप बी. बिल्कुल मोती की तरह, मोती की तरह क्लियर होना चाहिए. देखो पता नहीं कल मैं रहूं ना रहूं, कल ये क्लासेस हो ना हो, कल क्या पता कोविड आ जाए, कुछ भी हो सकता है. सो जिस जिस पल तक हम हैं उसका लाभ उठाएं और खुश रहें और एंजॉय करें. So that's what. So which one will have gas less abdomen? Type A and type B. Which one will have gas wala abdomen? Type C, type D. Which one is most common? Type C. Which one is least common? Type D. Which one is the second most common? Type A. Right? I hope you're getting it, bro. I hope you're getting it. Perfect. चलो जी, बहुत बढ़िया, बहुत बढ़िया. And last but not the least, इसको बोलते हैं H type. इसको नहीं बोलेंगे H type. Type D में H जैसा लगता है, लेकिन जो proper H type जो हम कहते हैं H type this is type E, basically type E, esophageal fistula. You will see this is the H type because it's like a proper H. It's like a proper H we have. Okay, and that's what. And yes, as there is a connection, you will see distal gas will be present because there's a connection somewhere. Okay, that's what. So what is the final answer? Can you now please tell me which all TEF type will have gas in the abdomen? The options are type A, B, C, D, E. Hanji, quick answers please. Exactly. The best answer on this planet is type C, gas abdomen, type D, gas abdomen, and type E. Okay, so C, D, E. A, B, C, D, है ना. ए बी सी डी ई, सिंपल. सी डी ई बात खत्म होती है यहाँ पे. सी डी ई विल हैव गैस एब्डोमेन. ठीक है, पढ़ो. ठीक है, पढ़ के बहुत अच्छे बच्चे बनो. आवर पेरेंट्स आर ऑलवेज राइट. पढ़ लिख के बनोगे नवाब, नहीं पढ़ोगे तो बनोगे क्या बनोगे? फिर अच्छे मतलब कम नवाब बनोगे. ओके, सो फनी. Yeah, this is good one, bro. This is a good one. Can you please answer in the comment section, buddies? What can you see? हाँ जी. What can you see anyone in this picture? This is how the X-ray is gonna come. Nowadays they are asking a lot of clinical based questions. Exactly. तो बता सकते हैं आप क्या लग रहा है इस पिक्चर के अंदर? I'll tell you क्या लग रहा है इस पिक्चर के अंदर. I have to zoom in this picture. Okay, 1 second. I'm gonna zoom it. Give me 1 second. Exactly. दो पल रुके. अयो, दो पल रुका का भूखा खर. हाँ जी. कैन वी अप्रिशिएटेड नाउ समथिंग? इतना जूम कर दिया भैया. ठीक है, व्हाट कैन वी अप्रिशिएट? क्या है ये, क्या हो क्या रहा है ब्रो यहाँ पे? आई एम नॉट एबल टू गेट इट. व्हाट इज दिस वन? ये कौन सी क्या चीज दिखा रहे हो सर आप? मेरे को तो समझ में नहीं आ रहा. As we all know, very important. Okay, see, this is a beautiful picture, bro. Photographic memory. Look at the photo and tell the diagnosis. Can we see this coiling of the tube in this one? Coiling of the nasogastric tube. This is the most beautiful diagnosis of tracheoesophageal fistula, my dear friends. Please remember, there'll be if you put a nasogastric tube, the patient will have a coiling of the nasogastric tube, of the NG tube. Okay, why? Because there is a distal part is blocked, right? There is no distal part, and that's it. So how do you diagnose it? Sir, मैंने X-ray करा in a busy if the Shubham is on night duty with me and Shubham is expecting a case of TEF, अगर बच्चे में Shubham expect कर रहा है tracheoesophageal fistula, then Shubham should get an X-ray done with NG in situ. X-ray with nasogastric tube in situ. And please remember, as you can see, if I put a NG tube, no, it will come out. it will come out. Why? Because there's a blind end, no dear, there's a blind end, right? So it will come out if I put a nasogastric tube. So I'll put one tube and I'll connect it. I'll put a micropore, I'll stick it. Are you understanding? ताकि जो coiling है वो ढंग से अपने आप ही नजर आ जाए, so that I can appreciate the coiling by itself. If you just put a tube and take an X-ray, in the meantime tube will come out only because there's a blind pouch, right? You can't force something inside. But if you put a micropore like a tape above, then I think definitely you can appreciate. That's why हम always हमेशा कहते हैं with X-ray of the chest with NG in situ मतलब अंदर, NG nasogastric tube. And yes, Dr. Ashish Singh is right. Sometimes the book says that you can even take a like Ryle's tube or NG tube, all are same only. Rubber catheter, the Oprighai 9th edition में लिखा है कि रबर कैथेटर अगर डालें तो ज़्यादा बेटर रहेगा करके, क्योंकि वो कॉइलिंग होने के और खुद से कॉइल होने के चांसेस कम हो जाते हैं इस करके. ओके, half an hour is over, 10 minutes left, then this class is over. Has everyone understood this much? Please let me know. समझ में आई इतनी कहानी? ठीक है. ओके ओके, यस और नो, क्विक आंसर्स प्लीज, ताकि हम जिंदगी में आगे बढ़ सकें और बहुत ही खूबसूरत और अमेजिंग इंसान बन सके. ओके, कहाँ है मेरा माउस? माउस 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 मैंने नए लिए जी. अच्छा, मेरा वॉइस में फ़र्क आता है कैसी? इफ़ आई एम स्पीकिंग लाइक दिस, इज देयर अ डिफरेंस? एंड इफ़ आई एम स्पीकिंग नाउ, like now if I talk, if I speak, can you hear a different quality of voice, or it's the same thing? मुझे बताना एक बार guys, if you feel any difference in my voice once now if I speak, then let me know, because I have ordered this amazing JBL speakers, what you called this microphone type of speakers. Okay, no difference, okay, no problem, that's fine. तो recording में आसानी रहेगी मेरे को. That's it. And very importantly, yes, which is the most commonest type of TEF? Type C is over, and type, this is a typical X-ray picture. And will you see gas or gasless abdomen? Very importantly, gas in the abdomen. Type C. Can you see the gas? This is important, bro. This is very important. Can you see the gas? The answer is this is the gas. Okay, it's important. It's a gas wala abdomen. Done. Okay. This was the patient who had come to us with a case of TEF, real patient of TEF. Hanji, anyone? Is it more common in males? It is more common in females? Put your answer in the comment section. Please let me know. Males में common है कि females में common है? Yes or no? हाँ जी, अब बताना. मेरी आवाज़ ऐसे आ रही है? एक म्यूट का बटन भी है इसमें. म्यूट ऐसे दबता तो नहीं यार, एक सेकंड. मेरी आवाज़ में कुछ चेंज हो ना, बताना फिर, ठीक है? इफ़ देयर इज़ अ चेंज इन माय वॉइस, प्लीज़ लेट मी नो इफ़ देयर इज़ अ चेंज इन माय वॉइस. ओके, मैंने कुछ ऐसे कुछ कम तेज किया है. Yes, exactly. Out of 4,000 live births, it is out of 4,000, one baby might have the incidence of TEF. Number one. Number two, yeah, very good question. Very good question. Is it associated with polyhydramnios, or is it associated with oligohydramnios? Can you answer in the comment section? Yes or no? Yes or no? Yes or no? Yes or no? Exactly, exactly. Okay, buddy. Okay, so it is associated with polyhydramnios, right? Yes or no? The answer is polyhydramnios. Why? Everyone knows about it. Still, I'll put a point. So Osama says oligohydramnios. Osama, जान से मार दूं? जान से मारूं मैं तुम्हें जान से? Oligo कैसे होगा? How does the liquor forms? The baby's urine. The baby's urine is nothing but, very important, is our liquor. So the baby passes urine, swallow urine, passes urine, swallow urine. That's what happens in a case of TEF. The baby passes urine and swallow urine, right? That's what, most importantly. So in the case of in a case of TEF, the baby is passing urine very well. The baby is passing urine very well, but is not able to swallow the urine. He's not able to swallow the urine, and because he's having TEF, so too much of urine. The answer is polyhydramnios. If the mother is a case of polyhydramnios, the baby will land up into tracheoesophageal fistula. Tracheoesophageal fistula. Okay, perfect. Next question, please. Exactly. So it is associated with polyhydramnios due to inability of the fetus to swallow the amniotic fluid, and those babies also will have a single umbilical artery. Can you please appreciate this? Such a beautiful picture, bro. Such a beautiful picture. Can you please comment in the comment section? ये क्या है? ये क्या चीज़ है? ये कितना सुंदर क्यूट सा पिक्चर है ये. We are so lucky we are able to appreciate such beautiful pictures, bro. What is this, anyone? So this is nothing but, can I say 2 artery and 1 vein? Can I write this? 2 artery and 1 vein. Umbilical cord कुछ नहीं बाबा, ये umbilical cord है, and there is a 2 artery and 1 vein. That's what. Okay, Osama says renal agenesis. ये क्या, ये इसका आंसर बताया, renal agenesis. Huh, so okay, the white thing, of course, is the umbilical clamp. White thing is the umbilical clamp. And can you see those arteries, bro? Two arteries and one में देखो जो जो साथ में है, जैसे तुम और मैं साथ में है, तो ये टू आर्टरी है, और जो अलग है ये वेन है, तो ये दो आर्टरी और एक वेन का आंसर है ये. Yeah. Okay. Uh-huh. Yeah. How will the neonate present? Such a beautiful question. Quick answers, please. How will the baby present? Dr. Shubham, answer बताओ बेटा. हम्म. अच्छा, मेरी आवाज़ में कोई डिफरेंस नहीं है. कुछ तो होगा मेरी सुंदर सी आवाज़ में डिफरेंस. एक सेकंड. मैंने JBL कनेक्ट तो किया हुआ है. कुछ और भी करते हैं क्या इसको? ब्लूटूथ. ब्लूटूथ तो नहीं है, ये वाईफाई है. JBL आ तो रहा है. कुछ तो होगा आवाज़ में, कुछ तो जादू होगा. नहीं, कुछ तो होना चाहिए आवाज़ में. आई डोंट नो. दे से दैट स्पीक दे आर रियली गुड एंड ऑल दैट. मैंने कुछ छेड़ा है, दो तीन बटन छेड़े हैं मैंने. बता देना अगर बटनों में कुछ कुछ अलग सी महसूस होए तो. इफ़ यू फील एनीथिंग एल्स, प्लीज़ लेट मी नो. थैंक यू. ओके. Yes. So yes, Doctor. Yes, very beautiful, Doctor Abhishek, Shilpi, XYZ, yeah, Prakruti, with nature. Okay. Yeah. Can I say, if I have a blind pouch air, can I say that I will have frothing of secretions? Can I say I will have excessive drooling and coughing after feeds? This is a very important point, bro. That's how the FMG and NEET PG question comes. Okay. So a newborn baby present with frothing of secretions, a newborn baby present with drooling of saliva, cough after the feed, kind of followed by cyanosis and respiratory distress. What do you think is the best answer? So the best answer for this question will be tracheoesophageal fistula, because whatever the secretions are, they are normal in the baby's mouth. They are not able to go inside, right? They're coming out because there's a blind pouch, right? There's a blind pouch. That's what. Okay, perfect. Yeah. Next question. Yeah, this is a good one. Nice question. This is a good question. Which type of tracheoesophageal fistula presents later with recurrent pneumonia due to aspiration? Nice question. Anyone put an answer in the comment section. Dr. Suman says, सर पहले से ज़्यादा अच्छी और क्लियर है, लिटिल बिट है. झूठ झूठ बोल रहे हो. जो मेरा दिल रखने के लिए मुझे लग रहा है आप आंसर बता रहे हो. सच बताओ, फर्क है कि नहीं है? सर बताओ. हाँ जी. एनीवन? यस. आवाज़ में फर्क आ रहा है या नहीं आ रहा है? डॉक्टर शुभम, मरियम, सच सच बताओ. ओके. या. Very good. So which type presents later with recurrent pneumonia due to aspiration? The beautiful answer is type H and type N. Type H and type N. ठीक है, याद रखिएगा प्लीज. अच्छा ठीक है. ओके ओके परफेक्ट. ठीक है. अच्छा. शुभम कह रहा है मजा आ रहा है, बस मजा आ रहा है. यहाँ जगराता, माता रानी का जगराता चल रहा है. अम्बे तू है जगदम्बे काली, जय दुर्गे छप्पर वाली, तेरे ही गुण गाए आरती ओ मेरी मैया, हम सब उतारे तेरी आरती. ठीक गाया मैंने. हाउ वाज इट? ठीक है. सो टाइप H and type N presents later with recurrent pneumonia due to aspiration, double stomach. This was the super speciality question. Okay. Next important point, please. Yes. अच्छा. Such a beautiful question. Question बोलने में मुझे बड़ा मजा आता है. या बहुत मजा आता है. वो नहीं है, क्या कहते हैं, वो कभी खुशी कभी गम में वो आता है ना. कहते वो शाहरुख कहता है, ये टायर किसने बर्स्ट किया? काजल कहती है मैंने. टायर पंचर करने में मुझे बड़ा मजा आता है. हाँ. ओके. यस. डॉक्टर शुभम, थैंक यू. वफा, हुसैन, अभिषेक, रितु, ओसामा. सच अ नाइस नेम. एक आईडी है यहाँ पे. द आईडी नेम इज अ लॉस्ट यूनिकॉर्न. लाइक अ लॉस्ट यूनिकॉर्न sounds very mysterious, right? A lost unicorn. Nice. What's your name? Tell me. Hanji, the beautiful answer for TF is associated with which anomaly? The best answer on this planet is Vactral anomaly. Vactral anomaly. And also it can associate with hypospadias and undescended testes. Hanji, आगे आ जाओ. Dr. Shubhan कह रहा हूँ. Dr. Shubham, what is hypospadias and what is epispadias? Anyone? What is hypospadias and what is epispadias? Anyone? कोई है कुछ मतलब होता है? नहीं, सेम ही लग रहा है यार, मुझे तो फर्क नहीं लग रहा. सेम लग रहा है, बताओ जल्दी. यस और नो? हाँ जी. So hypospadias and epispadias. So normally my urine should have like from the glans penis, right? So my urine should have a straight like इंग्लिश में कैसे बताऊं इसको मैं, सुसु की सीधी धार होनी चाहिए, ठीक है? When you pass urine, the stream of the urine should be totally straight, right? If there is a if my urine is not going straight, if it is going above the glans penis or below the glans penis, so that's what you have to say. It is a hypospadias or a epispadias. Other than the normal urine stream, if the urine is passing is going out from the upper part of the glans penis or the lower part of the glans penis, exactly, that is hypospadias and epispadias. Okay, and vector anomaly, हाँ जी आगे आ जाओ. This was the PG question. The PG question was what is T stands for in vectoral anomaly. तो इसी बहाने सारा ही बता दो यार. हाँ जी, लेट मी नो. हाँ जी, ऊपर से नीचे. हाँ जी, ठीक है, बिल्कुल सही बात है, ठीक है. हाइपो मीन्स नीचे. हाँ जी, हाँ जी, हाँ जी. ओके, डॉक्टर अभिषेक ने बड़ा क्यूट सा बेबी मंकी बनाया है. ये क्या है, सुसु कर रहा है मंकी, पता नहीं क्या कर रहा है वो, इतना छोटा सा आइकॉन है, समझ में नहीं आ रहा. हाँ, कैन वी प्लीज आंसर क्विकली. वी से क्या होता है? वी फॉर वर्टिब्रल, ए फॉर एनल एट्रेसिया, सी फॉर कार्डियक anomalies, T for tracheoesophageal fistula, E for esophageal, and R for renal, and L for limb anomalies. And the PG question was this one actually कि बाबा T से क्या होता है? T से क्या होता है? Exact, tracheoesophageal fistula. Tracheoesophageal fistula होता है T से, ठीक है? Has everyone understood this much? Please put a like button. ठीक है, एक सेकंड में ज़रा आवाज़ दोबारा चेक. ये ना नया स्पीकर लिया मैंने, नया स्पीकर लिया, मैं उसे छेड़खानी कर रहा हूँ, इसलिए भाई आवाज़ मधुर आ रही है या मधुर आवाज़ नहीं आ रही है? प्लीज़ श्रोतागण बताएं. श्रोतागण, श्रोतागण इज क्यूट हिंदी. आई लव स्पीकिंग लाइक प्रॉपर हिंदी एंड प्रॉपर इंग्लिश. लाइक यू नो व्हेन यू स्पीक इंग्लिश should be like just proper English, and when you speak Hindi it should be just beautiful pure Hindi, and I think that's the best part about it. Hanji, acha. Okay, Dr. Taku, we have Taku Won. He's saying please speak in English. Okay, please speak in English. Okay, I'll tell you a joke in English. Okay, वो क्या होता है, like what happened, there's a girl, okay, so this one girl says to the like she says that she speaks very good English. Okay, she speaks very good English. Do you want to hear her English? She speaks very good English. Okay, Shilpa, you start. Okay, 1 2 3, and then Shilpa says English, 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 English. This is known as PJ. What is PJ? Poor jokes. वो आता है ना, वो कौन देखता था पहले? नहीं, कपिल शर्मा में नहीं आता था वो, याद है उसामा पहले है शुभम, वो एक आता, कौन सा आता है वो, ग्रेट इंडिया लाफ्टर चैलेंज. इट यूज्ड टू कम इन स्टार वन. सो देयर इट वाज देयर. अच्छा, मेरी आवाज़ कैसी आ रही है बताओ यार? मैंने स्पीकर लिया जिससे कोई बता ही नहीं रहा. कहाँ चला गया यार स्पीकर? चला गया. कुछ फर्क हुआ आवाज़ में? इज देयर अ डिफरेंस इन द वॉइस? एक्चुअली दो स्पीकर हैं, वन इज मैक स्पीकर्स एंड वन इज दिस अमेजिंग ब्यूटीफुल JBL, क्या लिखा है इसमें, कमर्शियल स्पीकर्स. ओके, सो आई जस्ट थॉट ऑफ गेटिंग इट. हाँ, दैट्स राइट. ओके, परफेक्ट. कैन वी मूव फर्दर? ठीक है, राजू श्रीवास्तव वाला. हाँ, बहुत अच्छा था राजू श्रीवास्तव वाला, मुझे तो बड़ा अच्छा लगता था. डू यू गाइस यूज्ड टू अप्रिशिएट राजू श्रीवास्तव? दिस वन आई थिंक वाज वेरी नाइस. Nowadays also we have nice funny ones in the Netflix, but I don't know, I don't feel really great about it because they sometimes they send poor, like non-veg jokes and all that, so it's difficult to see with family. पुराने वाले अच्छे डिसेंट एनफ होते थे मेरे ख्याल से. ओह, वी हैव अ मोटिवेटिंग कोट, अ क्विक मोटिवेटिंग कोट विच विल, जो बदल देगी आपकी जिंदगी. क्या है ये कोट सर, बताएं? जो बदल जाए वो यार कैसा, जो छोड़ जाए वो साथ कैसा, सब कहते हैं प्यार फिर से हो जाता है, जो फिर से हो जाए वो प्यार कैसा. So that's a quick motivating quote. So love one, be one, feel one. It is as simple as that. And be one. That's it. And whom should you love? Yourself. You should be on the top priority list of your life. Don't give, I always say, and it's very true, don't give the paintbrush of your life to someone else. Okay, अपनी जिंदगी की डोर किसी और के हाथ में मत देना. एज अ फ्रेंड बता रहा हूँ, बहुत पछताओगे. Keep the thread in your hand only. Don't give the thread to someone else. Love someone else, but don't give the whole thing. Okay, because it's bad. Then you start judging, then you start expecting from the other person, you are not doing this for me, you are not making me happy, you are not doing this for me, so you put all the burden on the other person. Okay, so love should not happen that way. Okay, let's move further. ओके 1 सेकेंड। हाँ, सो मैं एक बार ये लगा दूँ। एक्चुअली आज ना वो मेरा लैपटॉप चार्ज नहीं हुआ था, इस करके मेरे को वो हटाना पड़ रहा है करके। तो मेरे लैपटॉप में कुछ वो रहता है करके, छोटी मोटी इश्यूज। अच्छा, अब ये बताओ आवाज़ अलग हो रही है? ओके, वेट, नाउ आई एम कनेक्टिंग, नाउ माई JBL स्पीकर्स आर कनेक्टेड। लेट मी नो if there's a slight difference in the voice, and if there is no difference in the voice, please let me know, because I will return, आज रिटर्न डाल दूंगा फिर अमेजोन पे, इसलिए कह रहा हूँ मैं। ठीक है। Okay, what the X-ray chest and X-ray abdomen will show in a case of tracheoesophageal fistula? We all know that, right? Can I write this beautiful line that X-ray chest plus abdomen is done with a red rubber catheter passed per oral, and coiling of the rubber catheter is seen? Or I can say failure to pass a nasogastric tube or a orogastric tube. Are you understanding? Even though if I pass a NG tube or OG tube, number one, either I'll not be able to put it only, and number two, there'll be coiling. If I forcefully put it, there will be coiling. ठीक है? Okay, मनीष कह रहा है वॉइस इज नाइस। कुछ फर्क पड़ा? हर चीज़ ही अच्छी लगती है। तेरे को ये बता, फर्क पड़ा कुछ आवाज़ में या सेम है? मुझे ये बता दो बस। ठीक है। अच्छा, हाउ डू यू डायग्नोज TF? वी आर कमिंग टू दिस ब्यूटीफुल एंड ऑफ दिस टॉपिक। इट वाज अ वेरी लाइट एंड डेलिकेट क्लास फॉर डेलिकेट एंड एलीट क्लास स्टूडेंट्स। सो हाउ डू यू डायग्नोज? ऑफ कोर्स डियर, इनएबिलिटी टू पास द NG ट्यूब। एक्सरे करा के देख लो, यू गेट अ एक्सरे डन, you'll get the whole story out of it. Okay, हाँ, this part is over. Treatment, हाँ जी, can we please, now this is a good one. Can you please tell me what is the treatment? Yes or no? Yes or no, please. We have a ID known as Next Chapter Civil Engineering. He says that he says I am civil engineer from IIT Delhi, but I really love your bio. That's why I am here. Thank you so much, bro. We just chit chat over here, okay? Like we just share some knowledge and just chill out. Yes, treatment क्या करना है, bro? Now this is an important point. Can I do surgery? Surgery will be a good choice because I have a proximal and a distal blind pouch, and I need to connect my food pipe nicely, right? So yeah, if the distance between the both ends, the proximal esophageal blind pouch and the distal blind pouch, if the distance between the both ends is less than 3 centimeter, I think surgery and end to end anastomosis of esophagus sounds a very beautiful option, sounds a very nice option. If the distance between the two ends is less than 3 centimeter, then क्या बोलते हैं उसको, end to end anastomosis sounds a good option. Next important point, yeah, if the gap is more, तब क्या करना है? Again, double star mark. This is a PG question, okay? See, this is where the examiner is asking you, and then you will say, "Okay, whole topic I read, bro. पता नहीं ये कहाँ से पूछ लिया? I don't know from where they asked this question." So remember, if the gap between the two ends is more than 3 centimeter, then is this is a bad prognostic criteria for surgery. It is a bad prognostic criteria for surgery, very important, if the gap between the two pouches is more than 3 centimeter. उसमें क्या करना चाहिए? Gastrotomy. So basically gastrostomy is a nice answer. I'll make a separate opening from my abdomen, gastrostomy, and esophageal repair by conduit. Okay, esophageal repair by conduit, मतलब कहीं और से चिपका दूंगा उसको, and esophageal repair by conduit, and the stomach part, gastrostomy will be a nice option because the distance is too much away. I can't do the end to end anastomosis. Yes, that's right. Complication, again the last point. What are the complications? I have a tracheoesophageal fistula. I did the operation, I did the end to end anastomosis and all that. What are the complications? Can I write my end to end anastomosis can leak? Star mark. Again a FMG question. Which is the earliest complication of tracheoesophageal fistula? Just after the surgery, that end to end anastomosis which I have done, it might leak. It might leak. Remember, okay? It might leak. Next, again, this is a very beautiful question. PG entrance question number 1, earliest complication. The answer is anastomosis leak. FMG question number 2, most common क्या होता है? Stricture बन जाता है अपने आप ही, automatically this is a stricture, okay? This is a stricture, okay? We have a next chapter ID. He says, give chance to become doctor, engineers, ये भी बन जाएंगे. Yes bro, engineers, our Indian engineers have huge power and you can become anything and everything. I have full trust. Exactly. So yeah, and other problems I can face is GERD, and the other problems I can face is our Barrett's esophagus. Barrett's esophagus is important. Okay, perfect. Oh, the voice is getting stuck. The voice is getting stuck. आ जाएगा, आ जाएगा. Sometimes a net issue, it will come. 5G लगाऊं, 5G लगाऊं, 5G, 5G. Once Pediatrics by Dr. Anand. Hello everyone, welcome to Pediatrics by Dr. Anand. Is there a change? Is there a change? Please let me know. एक मिनट, इसमें और भी बटन है. हाँ. Is there a change or no change? Yes or no? बातें देखो. हाँ जी. Okay, let's finish this part. Let me know if there's a change in the voice actually. And I put 5G. Yeah. So आ जाएगा, आ जाएगा. The treatment will be as I'm having tracheoesophageal fistula. Please put me in little upright position. And most importantly, as there will be drooling of secretion, there'll be drooling of secretions from the mouth. So it's better you put a orogastric tube and put a slow suction device attached to it. Very very important, remember one thing, that you put a orogastric tube because secretions are coming, right? Secretions are coming, right? So what you call, put a slow suction device attached to it, it will be fine. Okay, IV fluids, of course, because operation I have to do, patient will be nil per oral. IV fluids will be nice answer. And antibiotics, of course, if there is, you know, you if you're suspecting some infection, because so much of secretions and dribbling, and there is a tracheoesophageal fistula, all my secretion are going in my windpipe, also in my lungs, also I might have aspiration pneumonias, URTI, LRTI, and sick looking and distress and all that. So antibiotics sounds good, and surgery, of course. Okay, that's it. That finishes this super amazing 5-star billion-dollar topic, tracheoesophageal fistula. Has everyone understood this much? Yes or yes, yes. Yes or yes, yes. और मैंने एक वो भी बनाया था करके. अच्छा. ओके ओके. ओके, एमसीक्यूज करें कि रहन दें? आई डोंट नो, बहुत सारे एमसीक्यूज वैसे, बताओ. ठीक है, बाद में करेंगे, बाद में करेंगे एमसीक्यूज. ठीक है, काफ़ी है इतने. एनपीओ फॉर हाउ मेनी आवर्स? काव्या इज आस्किंग. एनपीओ फॉर यूजली सी लाइक एटलीस्ट 4 to 6 hours. Like we keep the patient nil per oral overnight. Overnight NPO, we keep the baby overnight. If tomorrow morning 9 o'clock, if the pediatric surgeon has planned for the surgery, midnight, like around 10 p.m. before night, we'll try to keep the baby nil per oral. ठीक है. Yes. Okay. अच्छा, हिमानी कह रही करो प्लीज. अच्छा, 2 क्वेश्चन करता हूँ. ठीक है, 2 क्वेश्चन करें या क्या करें? ओके. हिमानी बोल रही है कि कर लो एक बार, तो कर लेते हैं. ओके, कौन सा करें, कौन सा करें? ओके, 1 second. हाँ. H type. H type. H type presents with dash. Anyone can answer in the comment section. H type tracheoesophageal fistula. कौन से वाला था H type? A, B, C, D, E. Anyone can answer in the comment section. Exactly. Hanji. So H type was which one, bro? I forgot. Can you please tell me which one was the type? H type TEF? Exactly. The type E. Type E was the H type. This was the H type. Okay. Yes. What do you think? H type TEF is can present with dash, aspiration dysphagia, hematemesis, hemoptysis, and recurrent pneumonia. What do you think, guys? What do you think? Anyone? Yes, yeah, very good, very good. So, yeah, you remember one thing, okay? See, hemoptysis, hematemesis, I don't think so. Yeah, exactly. So, yeah, the patient can have aspirations. Of course, the patient can have dysphagia. So, aspiration and dysphagia, definitely the patient can have. The patient can have. Okay, this part is done. Okay. Okay, which one of the following life-threatening congenital anomaly in the newborn present with polyhydramnios, aspiration pneumonia, excessive salivation and difficult to pass a NG tube? Like such a straight question, like perfect answer, I think, of course, is tracheoesophageal fistula. है ना? कितना everything examiner has told. Okay, salivation, difficult to pass NG, polyhyd, सब कुछ तो बता दिया. Everything he has told. Exactly. This part is done. Okay, what is this picture, bro? Anyone can answer in the comment section. We have done this 1000 times. Yes, the answer is nothing but, very importantly, is this gastrochysis or omphalocele? This is nothing but gastrochysis. When intestinal contents are out and not covered in a sac, this is gastrochysis. Yes, that's right. This over. Okay, done. One question will do. Okay, one question. 1 second. Okay, huh. This is a good one. Now, this question I was asking. Last question, then this class is over. Hanji. The commonest type of congenital atresia or tracheoesophageal fistula is, हाँ जी अब बताओ, most commonest क्या था? Type C was the most commonest, no? What is type C? Can anyone answer in the comment section? Which one is type C? I don't know what is type C. I get confused. हाँ जी, so in according to this question number 4, what option do you want to click? A, B, C, D? Exactly. Beautifully told by Dr. R.R. Nishachri, one of my very favorite juniors. Amina Ali, Asha, Himani, Shweta, Pandey, Mariam, Osama, Priya, Shubham, Ritu, Manish, Kavya, A Lost Unicorn, बहुत सारे, Thor, Himani, बहुत सारे. Yeah, so type C. Which is the type C TEF? Baba, there is a proximal blind end and distal end communicating with the trachea. This I was telling you. कि ऐसे आया था. That's how the exam came. Question had come. Okay. This part is done. Types are over. Nice question. Can you please answer in the comment section, please? Gasless abdomen on X-ray. Gasless abdomen on X-ray. Where do you see? Where do you see? Where do you see? Where do you see? इसमें बताओ, इसमें बताओ. यस. यस, वेरी गुड. तड़पाए मुझे तेरी सभी बातें, एक बार है दीवाने, झूठा ही सही प्यार तो कर, मैं भूली नहीं हंसी मुलाकातें, बेचैन करके मुझको. Yes. So question number 5, the best answer I think genuinely is isolated tracheoesophageal fistula, because isolated tracheoesophageal fistula of course will have a gas less abdomen. Okay, because if I say esophageal atresia with proximal TEF, esophageal atresia with distal TEF or double TEF, in all those conditions gas will touch the abdomen of course, but in isolated TEF of course it will not touch. Okay, this part is over. Again, very nice question. 1 day old baby, excessive frothing from the mouth, baby was cyanosed. What do you think? What is the best answer, anyone? See, that's how the question will come. Okay, that's how the question will come. Doctor, who is asking, where do you live? Shubham, whom are you asking, where do you live? Anji, exactly. The answer is, the answer for this question will be esophageal atresia. Esophageal atresia. Okay, Dr. Himani says isolated TF कौन से वाला होता है? हाँ जी बताओ कौन से वाला होता है? जल्दी से फोटो देख लेते हैं ये वाला. This one, dear. You remember that? Where you tell me, isolated tracheoesophageal fistula will be which one? Isolated TF. Okay, so isolated as in, see, you can say proximal TF I saw in the type B, very importantly, and distal TEF very importantly I saw in the type D, distal TEF I saw in the type C also, and distal TEF I saw in the type E also, right? That's what. And without TEF I saw in the type A, right? So the answer for that question is isolated TEF बोल के, there is no specific answer to this one. Are you understanding? वो तो बस वैसे एक एग्जामिनर एक पॉइंट ऑफ ओपिनियन से सोच रहा था कि आइसोलेटेड TEF बोलोगे तो गैस होगी कि नहीं होगी. The answer will be that there will be no gas. That's it. Next question, please. Over. हाँ देखो ये क्वेश्चन था. आई एम ऑसम ब्रो. सी आई टोल्ड यू ना, ये क्वेश्चन आया था. Esophageal atresia may occur as a part of vectoral and group of anomaly. What does TE stands for? Anyone? TE stands for, very simple question. देखो, we are so lucky that we are able to understand the whole thing. Yeah, so TE stand for, of course, tracheoesophageal fistula. That's right. थक गया मैं. Such a easy question, guys. Can you please answer this question? Any very easy question, please. Quick answers, please. This class is over now. हाँ जी. A newborn baby had normal Apgar score. Okay. Develop excessive frothing and choking. Such a beautiful line, bro. Please, hello, allow your brains for this beautiful हवा की तरह information अंदर आनी चाहिए. Choking on attempted feeds. TEF. Frothing excessive. TEF. What is the investigation of choice? You want to do MRI, bronchoscopy, esophagoscopy, or X-ray chest and abdomen with the red rubber catheter passed per oral into the esophagus. आंख बंद करके I'll close my eyes and I'll choose option number D. Am I right? Am I right? Oh yes, I'm right. I am right. I'm so funny. Okay, I think we have done the question. अब सारे question ऐसे ही घूमेंगे. See, we are very lucky that we are able to appreciate these MCQs. A newborn has dribbling after feeds, respiratory distress, frothing from the mouth. What do you think? I think tracheoesophageal fistula. Next one, over. That finishes this today's class. So, did you like the class? Yes or no? Please put a like button to this video, or you can like give me a golden heart or a blue heart or a black heart. Before leaving, we always have a motivating quote. And yeah, the motivating quote is, what we know. What we know is a drop, what we don't know is an ocean. Such a beautiful line by Isaac Newton. Can we please thank Isaac Newton for this $1 million line? Very important. What we know is a drop, what we don't know is an ocean. So, what is the moral of the story? The moral of the story is very, very important. Never stop learning. There is no age of stopping of learning. Okay, never stop learning. Okay, it will be beautiful if we learn again and again. Never stop learning. It will be helpful for all of us. Okay, what we know is a drop. What we don't know is an ocean, and that's such a 360-degree line. I think sometimes. Anji, yes, exactly. Yeah. Okay. Thank you so much, everyone, with this wonderful participation. That's it. We next 3 days we're not gonna have a class. I'm going to Jaipur tomorrow, and tonight also I have to do packing. That's why I did not put a midnight 11 p.m. class. मुझे packing करना है. और क्या बोलते हैं? Tomorrow is Saturday. Saturday, Sunday, Monday, Tuesday I'll come, and Tuesday evening 5:15, 8:30, 11 p.m. same classes will have. Just few days left for 30th of this month to happen, and life is beautiful. That's it. Okay. Please take care. Have a wonderful evening ahead. Dr. Osama. Yeah, I was just thinking about you that you will share some good quote. And yeah. Okay. Dr. Shubham says, voice अच्छा आ रहा है. Perfect, sir. A great device you bought. मेरा दिल रखने के लिए कह रहा है कि सच में आ रही है. मैं अलग से पूछूंगा तेरे से. सच बताओ, बहुत महंगी है. 12,000 रुपए की है. 12,000 की डिवाइस है. इसलिए ठीक है. Yeah. What is Jaipur? Just like that I'm going. Dr. R. Nisha Shri says, life is beautiful. Yes, life is beautiful. The PDF of this class is in my heart. Otherwise, you can note it down. Pen copy. Tuck, 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 tuck. Note it down, please. It will be helpful. Thank you. Okay. डॉक्टर रितु सतना, आज की क्लास 11 बजे वाली नहीं होगी. नहीं डियर, आज नहीं होगी क्योंकि मुझे कल जयपुर जाना है, तो आज मुझे पैकिंग करनी है. मैंने पैकिंग नहीं करी इसका. ठीक है. हाँ जी. डॉक्टर ओसामा हैज अ कोड. कैन वी प्लीज अप्रिशिएट डॉक्टर ओसामास कोड? एंड शुभम बता दे भाई, सच बता यार, आ रहा है डिफरेंस के नहीं आ रहा आवाज में? दोबारा तो मुझे नहीं पता. मुझे नहीं पता. दोबारा आवाज सुनेगा तू? अब मुझे नहीं पता, तू दोबारा सुन आवाज एक बार. हाँ जी. देखो. ओके, सो आई देयर आर 2 trials. ओके, आई विल से हेलो एवरीवन एंड ऑल दैट. सो ट्राई टू make a difference. Okay, now I'm going to put my Mac speakers and I'm gonna say something. Okay. Mm. Hello everyone, welcome to Pediatrics by Dr. Anand. Today's topic of choice is life is just beautiful. That's it, nothing else. Okay. Hello everyone, welcome to Pediatrics by Dr. Anand. Today's topic of choice is that life is the most beautiful gift we can ever have on this planet. Thank you. कौन सी आवाज ठीक थी? Was there, tell me very frankly, otherwise I'll kill you. Okay. Was there a difference or no difference? All same in thing only? Let me know, please. कुछ फर्क आया कि नहीं आया? हाँ, no difference. Okay, fine. I'll agree with that. No difference. Maybe मेरे को चलाना नहीं आ रहा शायद. हाँ. मैक में थोड़ा और अच्छा है. ओके. ओके. ये वाला. ओके. अभी वाली अच्छी है पहले वाले से? सच बताओ, मुझे नहीं पता. अभी तो कोई कह रहा है वो वाली अच्छी है. This one is my Mac speakers. This is my Mac speakers. Is my voice coming? Yes or no? Today's topic of choice is ba 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 ba. Mac was better. Okay, Mac was better. There's a slight difference, but 12,000 जितना नहीं. I agree with you. Okay, fine. Maybe I think while recording the lectures, I guess there'll be difference. No. Yeah. Because I think while recording the lectures, maybe because AC का आवाज़ ना बहुत घूमता है कमरे में, the whole voice comes here and there. Maybe I'll try to. हम connect हो तो गया है dear. इसमें button भी light भी आ रही है. So that's what. I don't know. Let's see. Okay, thank you everyone for this wonderful participation. And we have to speak Dr. Osama's quote. My laptop battery is just 4%. Osama कहाँ है? Yes. Osama says, wait. So Dr. Osama Sheikh has a beautiful quote to share. He says, यकीन मानो ये मोहब्बत इतनी भी आसान नहीं. यकीन मानो ये मोहब्बत इतनी भी आसान नहीं. हजारों दिल टूट जाते हैं एक दिल की हिफाजत में. Yes, बहुत प्यारा है, बहुत प्यारा है. मतलब मुझे तो बड़ा पसंद आया. आई रिपीट अगेन. यकीन मानो ये मोहब्बत इतनी भी आसान नहीं. हजारों दिल टूट जाते हैं एक दिल की हिफाजत में. Yes, I totally agree with you. I totally agree with you. Okay, okay. Perfect, perfect. Thank you so much, everyone, for this wonderful participation. I hope you had a great time, and I also had a great time too. And please take care of yourself. See you on Tuesday. Till then, miss you and bye.